All right, Fern, we're back. It's the night shift, a new show. I'm excited.
It's good to be back. I mean, already this intro, this motorcycle, wow.
Yeah, obviously we added our own non-copyrighted music, but I think it plays.
Oh yeah, I mean, look how well it goes with that helmet.
Oh, the helmet. I mean, like, why wear a helmet that would actually protect you in a motorcycle accident when you can let everyone know I was in the military?
We're losing him.
Do something.
I can't stop the bleeding.
Take out the branch.
Can't take out the branch. He'll bleed out.
No, he won't.
Sir, give him back and give us some space.
I'm a doctor. We're gonna take the branch out and do a DPL.
We don't have enough blood to transfuse.
Yeah. Give me all your bags, a saline pack, couple tubes, a needle and scalpel. We're gonna go on 3, right? 1, 2, 3.
And I'm going to go ahead and stop it right there. Fern, where do we even begin with this clip?
I am cussing right now, Dr. Grumpy.
That's inappropriate.
Well, every hospital orientation I've ever been to has prepared me for this. I am concerned, I am uncomfortable, and this is definitely a safety issue.
Are you telling me he just went through the entire CUSS acronym in one 10-second interval of medical decision-making?
Definitely. Okay, so to recap the scene, we've got an impaled worker, medics on scene, it's complete chaos, no one knows what they're doing, but thankfully we've got a badass motorcycle doctor riding in to take charge.
I'm actually surprised they weren't doing a little bit better there because the other non-medical personnel had some helpful tips.
Take out the branch. Take out the branch. Take out the branch. Take out the branch.
Take out the branch is very helpful feedback. But you could tell that the paramedics are struggling with what decision here?
Taking out the branch.
And should they be struggling with this decision?
100%. I mean, their role is to stabilize patients and transport them to the nearest hospital.
The reality is this is potentially the least sick he's going to be. They need to get to a hospital as fast as possible, and that means putting the patient in the back of the woo-woo cab and getting to the hospital.
Burn some rubber, baby.
But instead of doing the right thing, we have cool motorcycle doctors say, I'm going to do a DPL, which is 100% not what he did, but we can just move on from that point. And then he says, my favorite part, this.
I'm a doctor. We're gonna take the branch out and do a DPL.
We don't have enough blood to transfuse.
Yeah. Give me all your bags, a saline pack, couple tubes, a needle and scalpel. Couple tubes.
Quick, Fern, tubes.
NG tube.
No.
Oh, rectal tube?
No.
You want a peg tube?
Fern, give me tubes.
Oh, suction tubing?
Tubes.
Oh, the tube.
The tube.
See, if you were specific, I would know right away, but when you're just yelling tube, I don't really know what you're talking about.
That's fair.
He's gonna bleed out.
Yes.
No, he's not. His renal artery is cut. I'm gonna clamp it. We're gonna use his blood. Start a line.
Whew. All right, Fernie Fern. I just need to point out, one guy's jamming gauze in his abdomen, the other guy's jamming tweezers into his abdomen. They cannot see anything that they're doing. It makes one wonder, could there be a better setting to be doing this procedure than the side of a hill in the middle of nowhere? Obviously, though, it can't get any worse, can it?
Go. Hang in there, buddy. Keep breathing.
Keep breathing, buddy.
You're telling me this guy lost too much blood, and now you're actively cutting into him?
It's all part of his plan. Oh my gosh.
Right. When that fills up,
They're collecting blood to give him
in your bag, kind of like a bucket brigade at a fire.
Surely that blood's super clean.
The big part of it, too, is he looked good while doing it.
So, Dr. Grumpy, I gotta ask, is this a real procedure?
Actually, this is a real concept. There are rare circumstances where you might do intraoperative blood salvage, which is what he's attempting to do. It's not this setting, though. All you're accomplishing is taking really dirty blood from the abdomen, which probably has stool mixed in it, and giving your patient sepsis instead of giving him saline like you should have and getting him to the hospital.
Holy crap, it's working. Where'd you learn that?
Afghanistan. All right, let's move.
Time of death, 6:17 p.m.
Yeah, and if you're wondering if we're going to do anything more with this guy's story, it literally ends there in the show because He died in the field.
Must be at the morgue where there's no cameras.
Well, that concludes our introduction to the night shift. I'm going to be honest, I hate the show, but what grade would you give it?
I think I would give it a D.
Oh.
So it's still failing, but not an F. And that is solely because they're wearing gloves, which a lot of other shows don't do.
Oh yeah, at least they're getting the PPE bar. That's a beautiful thing to hit. How about we do a quick recap list of just kind of the high-level concepts that we covered for our followers?
All right. Number 1, please wear a proper motorcycle helmet.
Number 2, be specific about which tubes you need.
Number 3, if you're in this situation, don't take out the branch.
Number 4, transport the patient early. Please don't dick around in the field.
And 5, don't transfuse poopy blood. That is a big no-no.
Yeah, I'm actually thinking, I can't think of a setting where you need to use poopy blood for anything.
No.
Don't use poopy blood.
If you found this even remotely funny, you can check us out on Twitter, where we also try to be funny and shed some light on the dark pit that is med Twitter.
Yeah, well, I'd say we're like mediocre comedians, but it's exciting to be in that category.
If you made it this far, you probably think we're funny.